The best way to move forward is include a public option with the opt-out provision for states.
Well, I'm disappointed because I believe that there was a better way of accomplishing the goal of leveraging the insurance industry.
If Harry Reid's gamble on the public option works, it's going to be Democrats only, exactly what the White House didn't want.
And if you're scoring at home, that went from 1 to 0 in the Republican column for health care reform. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And it's twitter.com/thenote for more political communication as well as handicapping of the Yankees' road to victory in the World Series.
Man, you are going to be unbearable throughout this series.
As long as they're winning, I'll be unbearable.
Kick us off. What's your top line?
Reid's dice roll. Thank goodness that Harry Reid's from Nevada. We can use all kinds of gambling metaphors, and Harry Reid is putting forward a public option as part of his health care bill, except he doesn't quite have the votes yet. We know now that Olympia Snowe, the one Republican who supported this, will not be on board. Several Democratic moderates say they're skeptical, but it seems like he thinks he's got the magic here.
Well, he certainly thinks he has the magic formula, perhaps, even if the magic itself is not working on all 60 senators yet. He believes having this out there is going to get the White House on board to whip these final 3 votes. Blanche Lincoln, among them, who's up for re-election next year. It's a fascinating development and no bipartisan cover, so we'll see how this plays out. I don't think it's a done deal just yet. Double digits down. Yes, the latest Washington Post poll on the Virginia governor's race shows REID'S, the Democratic candidate, 11 points behind Bob McDonnell, the former attorney general, the Republican running for governor there. This on the same day that Barack Obama is touching down in Norfolk, Virginia at Old Dominion University for a big rally the Democratic troops, try to help Cree. We heard yesterday from Nathan Daschle, the DGA executive director, saying that they do have serious problems in the polls right now that still need to be solved. This poll was not the direction they wanted to go in.
And it's a good thing that the White House has already said he's going to lose. Since he's going there and they're seeing this, they're trying to protect themselves politically when they do what they have to do. As the head of the Democratic Party, he needs the campaign for REID'S in Virginia today. Upstate showdown. The road to 2012 may indeed run through an upstate New York congressional district where now Tim Pawlenty, as forecast very strongly here on Top Line last week, is endorsed. That's right. The Conservative Party nominee gets the endorsement of Tim Pawlenty, also Fred Thompson, also Sarah Palin. Newt Gingrich lining up on the other side, backing the Republican in that district, saying you need to make some kind of compromises. But right now, this is really the battle for the heart and soul of the party, as we've said, is in this congressional seat.
That conservative interest group, Club for Growth, which is bankrolling most of Hoffman's ads to the conservative candidate, up with a new ad making it a 2-person race. The Republican has faded here, and if the conservative wins, it's going to be sort of shocking inside the Republican Party. And finally today, Afghanistan timing. Yes, our Jake Tapper reports that sometime between November 7th and 11th, circle your calendar, that is when President Obama is likely to announce and unveil his new Afghanistan strategy. This comes on the same day that John Kerry says McChrystal's request is too much, too fast.
Yes, and you look at this, a really interesting story in the Washington Post today about the one of the top civilians who was in Afghanistan resigning over the progress in the war, the first such high-ranking official to do so explicitly. I think just re-energizing this debate all over again.
No doubt about it, and that's where we're going to begin with our guest up on Capitol Hill, Senator Jack Reed. He's a Democrat from Rhode Island, and he advises President Obama frequently on the issue of Afghanistan. Senator Reed, thank you for being here, and
thank you.
I'd like to begin with Afghanistan. Our understanding and the reports that have been out there in the last couple days is that President Obama may end up settling, sending more troops, but fewer than McChrystal had really requested, this 40,000 that he thinks he needs to accomplish the strategy as he understands it. Is there a danger here for President Obama in sending troops, but too few to actually change the dynamic of what's going on inside Afghanistan?
Well, I think the president has taken a very careful and thoughtful approach, not just the president, but the whole national security team. Admiral Mullen has been directing studies of different combinations of troops. I think those are very thoughtful and productive studies. And the president also, in conjunction with General McChrystal and Admiral Mullen and Secretary Gates, are not just looking at troop numbers, they're looking at an overall strategy. In fact, one of the limiting factors in the strategy is not American combat troops, it's Afghani troops, and also it's the absence of any significant governance in the local areas by Afghanis and American civilians and international civilians to help. So he has to put that all together, and I think he's doing a a good job of putting it together.
I'm sure you saw the story in the Washington Post today, Senator Reid, about the top civilian in Zabul province tendering his resignation and saying that we're basically part of a 35-year civil war over there. It sounded to me a lot like the argument that people made against continued presence in Iraq, that our presence there is drawing insurgents and is inciting violence. What did you make of that? Any concerns that you saw there that you think should be part of this debate?
Well, I think it underscores the need for evaluation of what's been done there. Unfortunately, and I've been over into the country on a number of occasions, 4 or 5 years ago, it was a much different place in terms of security, in terms of potential, in terms of what we could have done. But now, I think through the wrong-headed approach to Iraq by the Bush administration, we're now in a situation in Afghanistan where it's much more complicated. The Taliban has reformed. There is growing kind of frustration by the people, not only with their government, but also with the fact that we haven't produced the immediate benefits that they assume. So I think it just reflects a great deal of the frustration, but it also underscores the need to step back and carefully analyze our policy and our strategy.
Any scenario that you see, Senator, where as part of the strategic review, the president doesn't authorize additional forces in Afghanistan?
Well, there's an emerging consensus that additional trainers have to be deployed because the key in the long term to avoid the repetition of this cycle is an Afghani security force that is capable and can provide basic stability. So that is something I think everyone concedes will be increased. The real issue is brigade combat teams, the combat forces. My sense is that, as been reported, the president is looking at several options, including an increase, I don't know what the number is, but including an increase of those forces.
Senator Reid, I want to turn your attention to health care for a moment, if I can. Obviously, there was some big news from the majority leader yesterday. You applauded his decision, I saw in your reaction, to include a public option with the ability for states to opt out of that public option in the bill that is going to hit the Senate floor. But he announced that at the loss of Olympia Snowe, the Republican from Maine. How problematic is it, do you think, for your party to do health care reform all on its own with absolutely no sheen of bipartisanship?
Well, I think the important issue is to try to do it right. If we can get a bill through simply for the sake of being bipartisan that doesn't work, that's not going to help the country nor particularly our caucus. I think we have to do it right. I think the public option is the right thing to do. 60% of the American people want a public option. It is going to be, I hope and believe, an effective way to provide competition in these marketplaces. In Rhode Island, in my home...
I'm sorry, excuse me one second. I just want to clarify something. You said to do something that works. Does that mean that if the end result, when this is all said and done, is actually Olympia Snowe's idea of triggering a public option later if the insurance companies don't immediately start lowering their prices, that you would consider that a health care bill that doesn't work?
Well, no, I think what you're talking about is suggesting the trigger. That's one possible way, along with the opt-out, to try to assuage some of the concerns of people around the country and different stakeholders. But my concern is that we would have a legislation with no public option, that we would have just private insurers. In my home state of Rhode Island, 2 insurers have 80% of the market. That's not a competitive market. And as a result, our rates are high, and a provider pays to physicians are lower than the physicians think are appropriate. If we have competitive markets, then we're going to be in a much better position. And I find it, frankly, ironic that it's the Republicans who are arguing against the way to make some of these markets more competitive.
Senator, briefly, a lot of folks that look at this say the way to really save money on the public option is to be able to tie it into Medicare reimbursement rates and be able to take advantage of those kind of savings. That's not here, and of course we have the state opt-out. Does this do enough? The way that it's being structured right now by leadership, does this do enough in terms of controlling costs?
I think it does enough. I think there's a possibility that without the public option, private insurers, particularly for-profits, will see that no incentives to change their behaviors dramatically, and they will find other ways, non-market ways, to sort of exclude risk. I think with the public option, you will have an opportunity for people to go and to find health care and to do it in a way which they will not be sort of unfairly dealt with.
Senator Jack Reed, Democrat of Rhode Island, thank you very much
Thank
for
you.
being here today, sir. We appreciate it.
Appreciate it. Big fan of the name Jack. Thanks a lot.
Thank you.
Well, we mentioned the New York 23 race a moment ago. Take a look at who has made an appearance in this race, endorsing the conservative candidate, Doug Hoffman.
Big government, high taxes, deficits, broken promises. America's in trouble. So when your grandchildren ask you why you didn't do something, be able to tell them that you voted for Doug Hoffman. He's not a career politician. Doug's like us, a concerned neighbor who's just had enough.